Hello, my name is Pete Antros, registered respiratory therapist and inventor of Pulmonary Expansion Therapy Device, PXT, with patents pending. PXT is an airway clearance device intended to treat infant and pediatric patients suffering from atelectasis, airway collapse, and retained secretions. Healthcare providers have used percussors and vibrators to perform chest physiotherapy on patients spanning 2 centuries. PXT is the first handheld vibratory percussive therapy device to utilize negative pressure from a regulated vacuum source to more efficiently attach to and manipulate the chest wall for intermittent therapy. PXT uses suction pressure as an opposable thumb to allow a caregiver to facilitate a deeper spontaneous breath by attaching to the chest wall, lifting the rib cage, and expanding the underlying segment. Like cupping, made famous by athletes such as Michael Phelps, PXT also helps direct blood flow as well as airflow to the treated lung segments by decreasing pulmonary vascular resistance. PXT is the first airway clearance device to be able to target specific affected lung segments while avoiding delivery of PPV to healthy lung segments. Positive pressure ventilation. Rather than blowing up the entire bronchial tree using positive pressure ventilation, PXT generates negative pleural pressures in affected lung segments, drawing air past mucus plugs. Once enough air is drawn past the plug, that same air is used during exhalation to dislodge the plug, enhancing a patient's own cough mechanism. The ability to lift a patient's chest wall using vacuum pressure depends on the weight of the chest wall, the force level of vacuum pressure utilized, and the surface area of the chest exposed to suction pressure. PXT allows the user to select the minimum vacuum pressure needed for chest wall attachment while interfacing with any size anesthesia mask, which controls surface area of skin exposed to suction. The theory for negative pressure ventilation is older than the iron lung, invented in the 1920s to effectively ventilate patients during the polio epidemic. The iron lung applied selected negative pressures to the entire body inside a sealed tube, with just a patient's head exposed to ambient air pressures, creating a negative thoracic pressure drawing air into the lungs. In the 1980s, Dr. Zamir Hayek invented the chest cuirass, which applies vacuum pressure to just the thorax. PXT utilizes localized negative pressure applied specifically to the chest wall in a more focused manner than the previous methods. Just as the Hayek is a miniature version of the iron lung, PXT further minimizes the surface area needed for effective chest wall expansion. Using PXT, the healthcare provider is able to aerate the lungs while avoiding risks associated with administration of positive pressure ventilation, such as intubation, sedation, ventilator-induced barotrauma, as well as bronchopulmonary dysplasia. Whether you are a parent of a sick child, a respiratory therapist, or any other healthcare provider, when you hear a child breathing through congested airways, you have an urge to make them cough. PXT allows the user to effectively force a child to take a deeper breath, thereby triggering his own cough reflex. The ability to expand the chest by generating a localized negative pressure field is also affected by the flexibility and plasticity of the patient's rib cage. The younger the patient, the more flexible their bones are. The effectiveness of PXT is enhanced in the youngest of all our patients while retaining the natural protection the rib cage and chest wall provide to the lungs. PXT offers a more comfortable, more effective method of airway clearance, relying on an innovation of a proven method of chest expansion.